Well, good morning and thank you for attending. Today I'm joined by Dr. Carol Zimbalati, public health physician, to give an update on a local COVID-19 situation. Shannon Mantha, Executive Director of Clinical Services and Chief Nursing Officer, will provide an update on the vaccine rollout. Before we proceed, I would like to take a moment to acknowledge that the health unit resides on land covered by the Robinson-Huron Treaty of 1850. This land is a traditional territory of the Anishinaabe people. This land is also part of the unceded territory of the Algonquin Nation. I would also like to acknowledge the Métis historical presence in the region. Despite inequities experienced by Indigenous peoples resulting from historic and ongoing colonization, communities have drawn on their strengths to reduce the risk of COVID-19 outbreaks and impacts. They have implemented community-driven public health measures, engaged in traditional knowledge and practices to take care of their health and prioritize the health of family and community members. We want to recognize the strength and dedication of Indigenous peoples, communities, and organizations across this land in reducing the spread of COVID-19 and supporting the efforts of public health. Today is our last scheduled press conference. Press conferences have allowed us to have an open dialogue with you, the media, who are vital to ensuring that the public stays up to date and has the answers they need to assist them in making informed decisions. Press conferences have shared valuable information. As restrictions are being loosened, cases are on the decrease, and we are learning to live with COVID-19, we'll be transitioning away from these regularly scheduled press conferences. But it's not goodbye. The health unit and I will still be available to answer any media questions and inquiries. And our COVID-19 status report continues to be updated Monday to Friday on our website. Should this situation change significantly and information needs to be shared, then we will return to press conferences as required and on a regular basis if needed. Thank you all for your time, dedication, and journalistic integrity. Your stories have helped to share valuable information over the last 2 years. Your participation has been greatly appreciated. And for the public, please continue to follow remaining public health measures, such as wearing a face covering when required. It is always good advice to wash or sanitize your hands often and stay home if you feel unwell. The health unit remains committed to providing vaccination opportunities to all those who are eligible. The pandemic isn't over yet, and vaccination remains our best protection to ensure the impact of the pandemic continues to fade, and that future variants have minimal impact in terms of illness or public health measures required. If the public has questions about COVID-19, public health measures, or vaccines, our call center is still available Monday to Friday from 8:45 a.m. to 4:30 p.m. We're almost at the light of the end of the tunnel, so let's continue to work together to see this through. Now I'll pass it over to Dr. Zimbalati.
Thank you, Dr. Chirico, and good morning, everyone. As of yesterday at 3 p.m., there were 8 individuals in the hospital with COVID-19. 2 of those individuals were in hospital due to COVID-19 symptoms. Our percent positivity is currently 18.7%, meaning that more than 1 in every 6 people who had a PCR test received a positive result. Since our last press conference, unfortunately, 3 individuals have passed away due to COVID-19. Last month, our region experienced the highest number of deaths related to COVID-19 since the start of the pandemic, with 8 individuals passing away. According to Ontario's Science Advisory Table's dashboard, there are about 1,070 individuals in hospital in Ontario currently due to COVID-19. This is a decrease of 7% in the past week. The health unit is currently managing 6 outbreaks in highest risk settings. This is up from 4 outbreaks last week. A recent review of evidence by Public Health Ontario in 2021 indicates that individuals may be infectious with SARS-CoV-2, the virus that causes COVID-19, 3 to 5 days before symptoms start and up to 8 to 10 days after. For this reason, individuals who have tested positive or have had recent symptoms of COVID-19 should continue to take some extra precautions for another 5 days after their 5-day isolation ends. Additional precautions would include wearing a face covering anytime they are around people they do not live with, avoiding visiting highest risk settings such as long-term care homes, retirement homes, or hospitals, and avoiding visiting individuals who have weakened or poorly developed immune systems, such as the elderly or those with certain medical conditions. Facial coverings are still required in most indoor public settings. Individual decision-making based on knowledge of the risks, however, becomes even more important as public health mandates and requirements continue to be lifted. It is important to know the risks to make informed decisions based on an individual risk assessment about when to wear facial coverings, getting vaccinated, or about participating in social interactions and other activities. Because personal circumstances may differ, as provincial mandates and restrictions are lifted, it is important that we continue to be COVID kind and support decisions made by individuals regarding additional protective measures they may continue to use against COVID-19. Now back to you, Dr. Chirico.
Thank you, Dr. Zimbalati. I'll pass it over to Ms. Mantha.
Thank you, Dr. Chirico. So as of yesterday afternoon, 3,981 5 to 11-year-olds in our district have received at least one dose of the COVID-19 vaccine. This represents 47% of 5 to 11-year-olds in the health unit district. This still remains lower than the provincial rate of 54.7%. As a parent of two school-aged children, I am sympathetic to how hard it may be for a parent to decide or to make the decision to have their child vaccinated against COVID-19. In deciding to have my children vaccinated against COVID, I looked at the risk versus benefit so I could make an informed decision. After doing research, it was clear that the risk of serious adverse reaction to the vaccine was extremely low. The research does show that COVID-19 vaccines were proven to help reduce serious illness and hospitalization. In weighing the extremely low risk of complications with the vaccine and the benefit of reducing the chance of severe illness and hospitalization, it made sense to have my children vaccinated instead of using a wait and see approach. Vaccinating your child will provide them with a strong level of protection against COVID-19 and any of the variants. It will also protect those you spend time with, like grandparents and good family friends. We are in the process of shifting our vaccine strategy from mass clinics to more targeted approaches, which will include clinics in schools and in locations that may have less access to the COVID-19 vaccine. As always, if you have questions, concerns, or you want to ask questions about public health measures or anything else, there are great resources on our website, or you can always call our call center. Parents and guardians who are ready to book their child's appointment can do so on the Ontario site at ontario.ca/book vaccine, or as Dr. Chirico and I have mentioned already, call the call center here at the health unit and we'd be happy to take your call. Keep in mind, walk-ins are accepted at all of our clinics across the district. Thank you, and back to you, Dr. Chirico.
Thank you, Matt. We've finished with our comments now, and we'll be happy to take any questions. You can put them in the Q&A at the left of your screen, and please put your name, if possible. So I'll turn it back over to Alex.
Thank you. Our first question is for Dr. Chirico. It comes from PJ from the Nugget. I don't mean to be a Debbie Downer, but many of the restrictions are being lifted just before March break. Is there concern about what travel or visits during March break may have on the COVID situation locally?
Well, first of all, PJ, I've never considered you to be a Debbie Downer, so you don't have to worry about that. It's a very good question. I think that you know, we're transitioning. We're learning to live with COVID. Does it eliminate risk completely? No, there's still circulating COVID. We're still seeing some cases, but the important thing is that, you know, we're not seeing significant hospital admissions that we can't deal with. Yes, the hospital is under pressure. They do have people in a hospital with COVID, but things are moving in the right direction. We are learning to live with COVID. So I think that the advice to give is that, yes, if you're going to be going to travel, if you're going to be in large crowd, you need to do a personal risk assessment, as Dr. Zimblady has mentioned, and that, look at your own personal risk and whether or not you need to be taking some precautions and wearing masks. And we hope that people will be supportive of those that choose to wear masks or not wear masks when it is lifted and in the situation that they're in, and be COVID kind, because there are many reasons for people that may have to continue with taking precautions because of health reasons. So yes, it does increase the risk somewhat. Only time will tell how it plays out. But some of the predictions are that because so many people have been vaccinated and so many people have had Omicron, that it has been very helpful and that we aren't seeing the serious diseases develop.
Thank you. Our next question is also for you, Dr. Chirico. It comes from Clark from your TV. Good morning. There is a vigil for Ukraine scheduled for this Friday evening. A large gathering is expected. What is your message to attendees? Should those attending wear masks despite the event being outdoors?
Yeah, I think it's first of all, I mean, it's such a terrible tragedy what's occurring, and I know that everybody's hearts goes out to people suffering in the Ukraine, and we're very supportive of their fight for freedom, and it is so terrible. But what you're asking really relates to what the answer that I gave before. Again, it really depends on. Although it's outdoors, certainly it really depends on your own your risks and whether or not you are going to decide to wear a mask or not.
Thank you. So that completes our submitted questions, and that will conclude our last scheduled press conference. Thank you.